So what we're looking at here is a patient that's come into the clinic with pain under their second metatarsal head. So we call this PMA2, or the plantar metatarsal area number 2. So it's behind the second toe. And this is not an uncommon spot to get this sort of callousing, because if you've got an unstable first ray, or the first metatarsal is flexible, or you've got a flexible flat foot, you overload the second metatarsal head. And this is why so many people get things like crossover toe, or ball of foot pain, or metatarsalgia as they call it, which is really not a great description of the pain. But so what we go ahead and do is clean up the callus, and you can see as we get deeper and deeper and deeper into this, that it's got this white macerated tissue where the tissue fluid's pushed out of the surface skin deeper into the foot. We don't have to remove all of that, because it can be quite painful, and that can actually recover as long as we don't take too much away. If we take too much, it'll be too painful and it'll probably bleed. So what we do is go ahead, remove all this. We're using the number 10 blade because it's a bigger area. We use the 10 blade because it's a little bit more efficient. And then we go down and usually use a little bit of feel, what that actually feels like as we get towards the end point. And we also look at the architecture, or rather the landscape of the skin in the foot. So whether we can see the almost like fingerprints under there. So we go ahead, remove as much as we can without causing pain. And now, of course, long-term treatment is to deload this area. We usually do it with a soft insole and with a metatarsal dome, which is a little lump which will sit just behind the sore area and take some of the pressure off of that area, and it will make a huge difference to this. And also a good cushioned shoe with a good forefoot, good support, so the foot isn't allowed to pronate too much, and it'll make this patient a lot more comfortable. So we often see this in guys that are on their feet a lot, in sort of packing shelves, or in just general labouring jobs, or just anyone who's on their feet for a long time.